Welcome everyone. I will be your host today with my presentation on HIV and AIDS. Starting off my slideshow, we have a little introduction background history starting with a quick timeline of the progression of HIV and AIDS. It was in the 1900s when the spread of HIV came from a kind of chimpanzees to the humans. I read that they may have traced it back to the 1800s, but they haven't had confirmed, so they are saying it's the 1900s were the first confirmed cases. The first case of HIV seems to be traced to 1959 from a blood sample of a man from the Democratic Republic of Congo. 1968 was the earliest case of AIDS that appeared in the Midwest. The 1980s was the start of the epidemic in the United States. In 1984, HIV was discovered as the cause of AIDS. In 1997, they created a new heart treatment, which caused a 47% decline in death rates, as well as they created the Combivir, which was a combined drug therapy. From 1987 and 1985, 2010, 2015, there were two bans placed, one being on HIV travelers and the second being on ban for blood donations from men who have had sex with men. Those bans have been taken off, and now it's for the travelers back in 2010, and for the ban on blood donations in 2015, it is if a man has been celibate for a year, they are able to donate blood. From 2012 until now, the FDA has approved the PrEP, which reduces the risk of HIV by more than 90%, and death rates have dropped by 80% since 1995. Still no vaccine is available. I have skipped a few of my points in this timeline, so if you want to pause it now just to go over that, go ahead. Bringing us more in depth in this timeline, in the early 1980s, there were new and unusual diagnostic patterns beginning to emerge. A benign, fairly harmless cancer called Kaposi sarcoma began appearing as a virulent strain in younger patients when it is only normally common in the elderly. This rare form of cancer was published in the New York Times and was claimed as the gay cancer, which was later identified as the Kaposi sarcoma. This cancer was then became the face of the disease throughout the 1980s and 1990s. In 1983, scientists were then able to discover that AIDS was caused by HIV, which was originally called the human T-cell lymphotropic virus type 3 or lymphadenopathy-associated virus, but the name was later changed to HIV. When the Center for Disease Control reported the new outbreak, they started by calling it GRID, which was the gay-related immune deficiency, which this caused a large stigmatizing against the gay community as they were being called the carriers of this deadly disease. However, as cases soon started to appear among heterosexuals, drug users, and hemophiliacs, this proved that the syndrome knew no boundaries. And in the 1980s, the people had feared that HIV and AIDS could be transmitted by touch. Princess Diana helped disprove this by publicly shaking the hands of an HIV-positive man, which was huge to remove the stigmatism that AIDS is transferred by touch. Fun fact, in 1985, actor Rock Hudson was the first high-profile fatality from AIDS. Diving into the cause of HIV, the HIV infection in humans came from a type of chimpanzee that came from Central Africa. The chimpanzee version of the virus was called CIV, or the simian immunodeficiency virus. This was probably passed on to humans when humans hunted the chimpanzees for meat and came in contact with their infected blood. AIDS is caused by the HIV virus. This is the most severe stage of this virus. Once the CD4 cell count drops below 200, or they develop certain opportunistic infections, it is considered under AIDS. AIDS is an acquired disease, and the only way to be infected is by the infection entering your bloodstream. It is not hereditary, nor is it passed by casual contact with another person. The primary causes of the HIV/AIDS being from the transmission of the infectious agents by one person or more. It could come from either their saliva, air, cough, fecal-oral route, surfaces, blood, needles, blood transfusions, sexual contact, or the mother to fetus. The disease causes a huge deficiency within the immune system. There are three main stages of HIV, this being the acute HIV infection, the chronic HIV infection, and the acquired immunodeficiency syndrome, or AIDS. Coming in from those three stages, we have going through the steps before it turns into AIDS of the HIV infection. These stages of the infection were outlined in 1993 by the Center for Disease Control and Prevention. Starting us off, we have the seroconversion illness. This occurs 1 to 6 weeks after acquiring the infection, and this feels very similar to a bout of the flu. Number 2 comes in with the asymptomatic infection. After the seroconversion, the virus levels are low and replication continues slowly throughout the blood. The CD4 and CD8 lymphocyte levels are normal, and this stage has no symptoms, and this may persist for years. Next, we have the persistent generalized lymphadenopathy. The lymph nodes in these patients are swollen for 3 months or longer and are not due to any other causes. Then we have the symptomatic infection. This stage manifests with symptoms. In addition, there may be opportunistic infections. The collection of these symptoms and signs is referred to as the AIDS-related complex and is regarded as the prodrome or precursor to AIDS. This is the stage where if you get treatment, it can cause you to have the ability to not progress to AIDS, but if no treatment is seen, it will progress into AIDS. AIDS is the stage that is characterized by severe immunodeficiency. These are the signs of life-threatening infections and unusual tumors. This stage is characterized by the CD4 T cell count below 200 cells. There is a small group of patients who develop AIDS very slowly or never at all. These patients are called the non-progressors. Going into a little bit about how HIV interacts with the body. Once HIV enters the bloodstream, it zeroes in on the lymphocytes, which causes viruses and bacteria to progress and become more present. These cells are the T helper lymphocytes, or the CD4 cells. When untreated, the CD4 cell number reduces throughout the body. The production of antibodies decreases as well, and a person infected with HIV will have a severely diminished immune system. The lack of immune system causes for the risk for getting the opportunistic infections or cancers. Once other infections double up and then triple, advanced HIV signals in, or rather the stage known as AIDS develops. Due to the lack of immune system, this causes for the flu-like symptoms and fevers and swollen lymph nodes. HIV does not directly impact the nerve cells, but it does infect the supporting and surrounding nerves in the brain and body, which can damage the nerves. The damage is to the conducting sheaths of the peripheral nerve fibers, and this causes the pain, weakness, and difficulty walking. Other complications are memory impairment, anxiety, depression, and dementia. As you can see, this is kind of a thick slide with lots of writing on it. This is due to the fact that because the immune system is what's compromised, your whole body is impacted. With the acute HIV, this is where you develop those flu-like symptoms, and they may last for a few weeks. Some signs and symptoms include fevers, headaches, muscle aches, joint pain, sore throat, painful mouth sores, diarrhea, weight loss, cough, and sweats. These symptoms may be so mild that you do not even notice them. However, once the virus in your bloodstream the viral load is quite high at this time. As a result, the infection spreads more easily during the primary infection than during the next stage. The next stage is the clinical latent infection, or the chronic HIV. This stage, HIV is still present in the body and in your white blood cells. However, many people do not have any symptoms during this time. This stage can last for many years, and if you are not receiving the antiretroviral therapy, we then progress into the symptomatic HIV infection, in which the virus continues to multiply and destroy your immune cells. This may develop mild infections or chronic signs and symptoms such as fever, fatigue, swollen lymph nodes, which is often one of the first signs of the HIV infection, diarrhea, weight loss, shingles, and pneumonia. The progression to AIDS. Once this stage occurs, your immune system has been severely damaged, but thanks to better antiviral treatments, most people with HIV do not develop AIDS. Untreated, HIV will typically turn into AIDS in about 8 to 10 years. This stage, you'll be more likely to develop the opportunistic infections or opportunistic cancers. Some of these signs and symptoms might include sweats, chills, recurring fever, chronic diarrhea, swollen lymph glands, unusual spots or lesions in your mouth, unexplained fatigue, weakness, weight loss, and skin rashes or bumps. For treatment, there is no cure for HIV or AIDS. Once you have the infection, your body cannot get rid of it. Treatment can help to block the replication of the virus in the body and slow down the disease's progression. Medicals called the antiretroviral therapy are a combination of 3 or more medications from several drug classes. Taking this approach has the best chance of lowering the amount of HIV within your blood. The classes of HIV drugs include the NNRTIs, NRTIs, PIs, integrase inhibitors, and entry or fusion inhibitors. If you want to read the full names, they are there. I do not want to attempt to pronounce them. Prevention can be key in order to avoid AIDS or HIV exposures. These include using treatment as prevention, using post-exposure prophylaxis if you've been exposed to HIV, use a new condom every time you have sex, tell your sexual partners if you have HIV, or ask your sexual partners if they have ever been tested or been exposed, using a clean needle. If you're pregnant, get medical care right away, as this can be transferred to your baby. And consider male circumcision, as there is evidence that this can help reduce the risk of getting HIV. Alright, so as per request, there has to be a video portion where this is seen on camera. So I have decided to do my question portion for that. So bringing us in with question number 1. What is the difference between HIV and AIDS? Is it A, HIV is a virus, AIDS is a bacterial disease? Is it B, there is no difference? C, HIV is a virus that causes AIDS? Or D, AIDS is a bacterial disease that causes, it says AIDS, but it's meant to say HIV. Question number 2. A person has AIDS when which of the following occur? HIV antibodies are found in the blood, exposure to HIV, the CD4 count is lower than 200, or an opportunistic infection is present, or a person has had HIV for 5 years. Question number 3. HIV attacks what kind of cells in the immune system? Erythrocytes, leukocytes, the T cells, platelets, or epithelial cells? True or false? HIV is a retrovirus, which means it moves into a healthy host cell and re-engineers their DNA to make more of itself. As a fun little bonus, who was the princess that shook hands with an HIV-positive man? Those are all my questions. The next slide will contain written questions with the answers bolded in red, and the slide after that is my resources of 2 sites in the book as well. Hope you enjoyed my presentation. See you later.
I just everyone assume that. You deserve to have a family, whether you like them or not.